Hey, I'm Dr. Seiler from Seiler Skin, and today we're going to shoot a couple of videos on Miss Edie, who's been a good patient of mine. She's going to give a little video testimony about her experience with IPL and the anti-redness kit for her rosacea, and then we're going to shoot a video on the actual procedure itself. She's been a patient of mine for a while. She's going to kind of describe her condition before. We've done 2 IPLs, and we have her on good anti-redness products. So why don't you just tell the camera a little bit about what issues you had before, and then we'll talk about what you've done.
Okay, the first thing was that I would flush very easily if I started coughing. If I just, cough and sneeze my face, I would flush and it would just get real red. If I wanted to have a glass of wine, my friends would tell me it looked like I was ready to have a stroke because my face would be so red. And I'm like, no, it's my rosacea. It's not, trust me, I'm fine with that. So I just had a lot of redness and flushing. And, when you flush, it's also hot, right. Which doesn't feel real good. And then I found out about IPL. I didn't even know there was anything like that. I'd never heard of it. I just thought there was a prescription cream that you used for the rosacea. Unfortunately, I never saw a difference with that. And then after you did the first IPL, I couldn't believe it, especially after a week after. My skin looked so good. And
that was after just one IPL. And
that was after just one. I mean, I could notice that my cheeks didn't get bright red, and because it would start in my cheeks and then, go all over my face. And then the products as well, because my skin always felt kind of dry, no matter what moisturizers I used. And the products you put me on, the Avene and with all the anti-redness, I think that is also just added to it because my face never feels dry anymore.
And you've been on the products for a couple of months, haven't you?
Oh my gosh, I've been on them since 6 months.
Yeah, I think since October, because we did the first one in October.
Yeah,
so something for the audience to know, and prospective patients, there's a lot of different IPLs, and I hear all the time that people have not been happy with the result of IPL sometimes, and there's a huge difference between a really good IPL and a not very good IPL. It's the difference between a tricycle and a Rolls Royce is what I tell my patients, and there's also a big difference of who does it. So if you've had IPL done before and you may not have seen the result that you want, it's incredible to see the difference with 1 or 2 IPLs with me can do compared to other things. So tell me, so we've done 2 treatments. We're about to do the 3rd today, and we're going to film that. Why don't you just tell us a little bit about your experience with the IPL itself? And it's a little uncomfortable when you get it done, and you'll see that in the video, but it's not bad afterward. And
yeah, it's not. At the time, it's a little. That's probably the best way to describe it. It's a little uncomfortable. Kind of helps to squeeze some squeezy balls a little bit. But it doesn't hurt when he's done. Afterwards, you don't have any pain. Your face feels a little warm, feels a little hot, but the cream that you give us, yes, I couldn't remember the name of that. First of all, it feels really good when you put it on. It's just very soothing and refreshing to the skin. And the first one, I had redness for the first day afterwards, the first IPL, and then it just slowly goes away. The second IPL, I think I was pink for about an hour, and after that, I didn't have any more redness or anything. I just kept using the sickle fate as you had instructed me.
And so a lot of that's because after the first treatment, we shut down a lot of the vessels, and so when you don't have as much target with the second and third one, the downtime's not as bad. It's less uncomfortable during the treatment. So I think your pain was also better in the second one than it was in the first one.
Yes.
Okay, it's a lot easier to get through once you do the first one. So.
And so this one should be a breeze.
Yeah, it shouldn't be bad. So did we treat your forehead too, or did we just do your cheeks?
No, you did the
whole face. Okay.
Mm-hmm.
So anyway, stay tuned for the next video. We just wanted to kind of explain what IPL does. It's also great for sun damage. Edie has a little bit of both, even though the red was more what bothered her. It's something, if you've ever heard that rosacea is not curative, that's technically true, but these treatments can make it a lot better. Some of my patients that have done IPL for years now may do a series of 2, 3, 4 treatments in the beginning, but then they come back once a year and then usually once every 2 years. So I have one patient now that we've probably done about 7 or 8 IPLs on over the years, but now that patient gets it done like every maybe 1.5 to 2 years. So it's a great long-lasting treatment. And anyway, so thanks for watching, and stay tuned for the video on the actual procedure.